Hello, this is Dr. Kassir and welcome to your consultation. We know it took a lot of nerves for you to make this consultation. This is usually an anxiety-provoking procedure to go to a plastic surgeon, and we're happy that you've made that decision. We're even more pleased that you're here to see us. So the first thing that's going to happen, we're going to meet and you're going to tell us what exactly it is that you don't like about your nose. Usually it's either a bump on the bridge, the wide bulbous tip, the fact that it droops down, and how wide the nose is this way, or a combination. Or you may have specific things that you want. We'll also ask you about breathing problems. Do you have any trouble breathing? Do you have any sinus issues? Because if that's the case, we will address those together. A little bit of statistics for you. The average person that comes here and gets a rhinoplasty, and we've done well over 10,000, is a 23-year-old female. Okay, that's the average. So if you're a little bit around that average, it's okay. We've done as young as 14-year-old girl to as old as in their 60s and 70s. But usually it's a young woman's operation. And again, there's a lot of nerves, so make sure you write down all your questions and we'll go over all of those with you. A little bit about technique that people want to know. What we do is called a closed rhinoplasty. So we don't make an incision here. We do it all from the inside. And what that means is there's no external scars on the base of your nose. So there's less tip swelling, there's less numbness, and your recovery is generally faster. Also, we don't break bones and we don't use hammers and chisels. So that also leads to less bruising, less downtime, and a better recovery. Finally, people have all these questions about recovery, all right? So recovery is usually about a week to 10 days that you have to take off. But if you look at our Instagram account, we have plenty of people that we show on lives after we immediately take their splints off and they're doing just great. You can wear makeup after that, you can go to work after that, you can work out after that, and it's not a problem. The main decision you need to make is, do you want to do a rhinoplasty, a surgical rhinoplasty or not? So if you're mentally ready for it, then we can make it happen for you and we will schedule you. You can speak to our scheduling coordinators. If you're not quite ready for a surgical procedure, please ask us about a non-surgical procedure, which I started in 2006, where we use injectable fillers and we contour the nose, where it gives you really good result. You can lift the tip of the nose, you can make it look smaller even though you're adding to it, and it's a great segue for people who are just not sure and they want to know how this might look and they're just not sure about going under the knife yet. So that's also a great alternative. So hope that addresses some of the initial questions that you have, and we'll be with you shortly.